Dyslipidemia, an imbalance of blood lipids, rarely shows symptoms, yet it is a driving factor behind cardiovascular disease. Against this backdrop, physicians and specialists gathered in Muscat for the Dyslipidemia in Clinical Practice Symposium, highlighting the importance of early diagnosis and tailored interventions to reduce the burden of heart disease.
This symposium is a joint symposium between Oman Heart Association and Oman Society of Lipids and Atherosclerosis. And the aim of the symposium is to discuss lipid disorders and the way to diagnose and manage them through appropriate lifestyle modification and certain medications, particularly in certain subgroup of people who suffer from certain diseases like diabetes or high blood pressure.
The program featured presentations on advanced imaging, lipoprotein testing, and novel therapies, reflecting a growing urgency to confront cardiovascular disease with sharper tools and updated knowledge.
We have different modalities of cardiac imaging. We have starting from the echo, which can detect basically the LV function or the heart function. In patients who are dyslipidemic, sometimes it can be affected when they have like an atherosclerotic heart disease. Also, we have the CT scan, which basically we have the non-invasive calcium scoring, which basically correlates well with the burden of the cardiovascular plaques in that patient. And if we suspect to have coronary artery disease, we might proceed with the CT angiography, which can give us the answer whether this patient has like a problem with the coronaries or no.
Dyslipidemia is a major risk factor to develop heart attacks. And one of the main issues is that when any person, not a patient now, should number one start the lipid-lowering therapy, mainly called the statin, to reduce the incidence of the first heart attack, what's called the primary prevention. That means we want to prevent the first heart attack. And the second issue, which is very important also, is preventing the second heart attack. And this is called the secondary prevention. So when to take a cholesterol medication as the primary prevention, this is one of the most controversial issue. But of course, it is very much established for the second prevention.
Speakers also shared real-world cases and clinical experience, offering doctors practical strategies to manage complex patients, from those with diabetes and kidney disease to individuals recovering from cardiac events. Experts here are charting a path from international research to everyday practice, a step that could transform how dyslipidemia is managed and how lives are saved. Reporting from Muscat, this is Saleh bin Khalfan al-Rahbi.